Good morning and welcome to another episode of the Indoor Environment Show. Great to have you here on the special edition on Black Friday here, coming to you live from our studios in Syracuse, New York. I'm Bob Krell, founder and publisher of Healthy Indoors Magazine. And as always, I'm joined by my co-host, Don Weeks, who is the president of the Indoor Environmental Quality Global Alliance, IEQGA, coming to us live from Ottawa, Ontario, Canada. I got that all right without even a bump there.
Yeah, about that. Pretty good.
Yeah, it's just I'm ready to do some shopping online, of course. I won't get anywhere near a retail outlet today.
No.
Um, so, so how are things up in the Great White North? We haven't spoken for a little while.
Yeah, been a while. We started into winter, which I think some of Western New York may have gotten some of that too.
Yeah, we did
Uh,
too. We did too. I mean, Buffalo got 6 feet of snow. We got like 4 inches of snow here, which
it's not that bad.
nah.
Yeah, no, it's getting towards the Christmas season, so everybody's out shopping, as you said, and I'm looking forward to a good session today.
So I guess without further ado, I'll let you introduce our guest.
Right. So Dr. Paul Jacob Bueno de Mesquita has a PhD degree from the University of Maryland School of Public Health. Jacob is a postdoctoral scholar at Lawrence Berkeley National Laboratory in the Indoor Environment Group. His position at the lab is as an environmental health scientist epidemiologist, and he also served previously for 2 years as a CDC fellow as part of CDC's Public Health Associate Program. So welcome to the show, Jacob.
There we go.
Hello.
How are you today?
Great. Wonderful to be here with you.
Yes, we appreciate you being here. I just wanted to mention as well that this particular episode is sponsored by Iziac. So let's get started with some questions. One of the first questions I have is I understand you have a BS from Georgetown University in Human Science and Global Health and a PhD, as I mentioned, and a postdoc from the University of Maryland School of Public Health and Environmental Health. And I'm wondering, how did you get interested in indoor air quality and in particular IEQ and aerosols, viruses, and influenza?
Great question. I have to attribute my introduction to this area to my professor, Dr. Rosemary Sokas at Georgetown University, when I took her occupational and environmental health course. We were learning more about how environments and workplaces shape population health. And this was followed by a 2-year CDC fellowship where I was working at a municipal health department in Ohio, outside of Columbus. And I was assigned to work on some of the emergency preparedness plans for the county. And one of the main programs we were working on was preparing for pandemic influenza or an anthrax bio attack. And so there were these questions about how do we inoculate everyone in the county within a very short period of time, or how do we distribute antibiotics to everyone within a short period of time? And since many of the plans revolve around a large mass of population coming through a public facility for a vaccine or to get a dose of antibiotics, it was a natural question about, well, if people are spreading influenza through the air and they're all congregating in large crowds together, is that really a useful strategy? Are we going to be spreading influenza to everyone by having them congregate like that? Also, at the same time, we were working on a tuberculosis contact investigation, and there were many questions about what sort of personal protective equipment we should be wearing when interacting with people that might be infectious with TB. And yeah, so I began to sort of piece together that there was a lot of perhaps lack of knowledge or understanding about the risks associated with airborne viral transmission or airborne TB transmission, and realized that Dr. Don Milton at the University of Maryland was studying this question and measuring aerosols, viral aerosols that people shed in their exhaled breath. And so that sort of led me, this sort of public health fellowship led me into this research area.
What's interesting about that is, so that happened. You were doing that work prior to the SARS-CoV-2 outbreak in 2020, right? So kind of set the stage for you there.
Exactly. My dissertation focused on quantifying the risk of airborne influenza transmission in a controlled setting. I used data from a human challenge study where humans were infected with influenza willingly and put into a room with immunosusceptible people, and half of whom were wearing a face shield and doing a stringent hand hygiene protocol. So we could really control for mode of transmission. Individuals exposed by the aerosol mode were those individuals wearing the face shield and doing the hand hygiene, because really the only way they could be exposed is if sort of an aerosol went around their face shield and they inhaled it in. So yeah, we were doing all of this work. We were trying to get the word out about the importance of viral aerosols, because we were detecting so much influenza virus in people with flu on our university campus at Maryland. And yeah, then the pandemic rolled around, and so we quickly shifted. It was quite simple to just start studying viral shedding of SARS-CoV-2. We basically had the Milton lab had everything set up to go. We had been doing this type of research for a long while.
Yeah, Dr. Milton obviously is one of the leading experts in this whole area over the last couple of years, more than a couple of years now, unfortunately. He has been called upon many times to talk about some of this type of activity that you have going in the laboratory, or that it was going on in his laboratory. So you did the initial onset of I'm going to change a little bit in terms of questions. So you bring up a very interesting point about bioaerosols. Did that strike a chord with other folks that were looking into the pandemic from a different viewpoint, shall we say, from a medical viewpoint, where they were looking and saying that's not normally where we get people sick, hence we ended up with the six foot distancing, and also a lot of concern about formites at that time and things of that nature.
Mm-hmm.
So this came from a different viewpoint, didn't it? What you were doing, as opposed to what, say, some of them in the medical profession were worried about.
Yes, we have a very strong, but perhaps smaller community of scholars and scientists that are studying airborne viral transmission, compared with the massive sort of biomedical research and practice realm. And so the medical community has a lot of power and a lot of influence, and is still sort of operating on a little bit of outdated science with respect to transmission of respiratory infections. It seems perhaps the pedagogy could be updated a little bit. And so, yeah, we were working really hard. Actually, it was quite frustrating because in the first, I would say even up till now, but especially in the first year or two of the pandemic, we were spending a lot of effort on trying to communicate everything that we have learned about airborne viral transmission, airborne influenza transmission, and what we were learning to also be true with airborne SARS-2 transmission to the medical community. Especially, we wanted to make sure that medical professionals had access to respiratory protection on the job. treating and caring for COVID-19 patients in healthcare settings. We know that those settings are higher risk for getting infected because there's so much potential exposure.
Well, and that certainly wasn't the case, right? At the onset, it seems like there was a lot of misinformation, right? I mean, or at least lack of consistent messaging coming out to the general public. I mean, I think CDC was guilty of kind of knee-jerk reactions and not really getting a clear message out there. So I can see as a researcher that would be frustrating, since your group had been involved with stuff that would have been very valuable if it was actually becoming common knowledge at the onset. So
Yeah, exactly. And so this is why we appreciate these opportunities anytime to be communicating our scientific findings and what we're learning. Um, uh, yeah, I mean, we invest a lot of our time and energy into doing science, and it seems that uh, we're sort of gaining a clearer picture of airborne transmission and risk in indoor settings, and we really need to start using that knowledge more, especially while we're still in the midst of a deadly pandemic, and also facing potentially severe influenza epidemic this year, as well as other respiratory viruses that are
right.
going around. The pediatric RSV has been quite concerning, and rhinovirus infections in school and so forth. Um,
It does seem like that it is a almost a perfect storm in terms of three different types of problems happening almost at the same time. So it's difficult, and of course, most of us have been given, I guess you would say, the leeway to not wear masks in environments. So getting people to go back to wearing masks, I think, would be a very tricky and very difficult, complex problem at this point, even though it may still be the best protection for many people.
exactly. We're in this world now where um, the pandemic has sort of been treated as over in many
Right.
places, and there's this great urge to want to get back to normalcy, and um, I also feel that.
Sure.
I want to get back to all the great social things um, that we have going on in our communities. And this is where I would say that one of the ways that we can get there more safely is by focusing on cleaning our indoor air, by ventilating, filtering, and using germicidal UV light, can make indoor settings where we congregate much safer, and where we can get back to a little more normality.
But I mean, to that point, are we ever going to, does it ever make sense to go back to the status quo based on what we've learned, via this pandemic? And I mean, or do we have to have, I think, some sort of a paradigm shift, in your opinion, again, toward ventilation, towards air cleaning, towards even building design and how we do things? Because going back to normal might not make a lot of sense, right? I mean, depending on how you
Right,
define
right,
normal.
right, right. So I guess when I say normal, I mean normal in terms of being able to more safely gather, but
Mm.
certainly if we could have a huge paradigm shift in terms of doing air cleaning, that would be really, it seems like a wonderful population health benefit that would have widespread benefit across the population for not only protecting from respiratory infections, but also promoting overall wellness indoors, where we spend almost all of our time.
Yeah, it seems like even more so than we had before. We spend more time indoors. So
But
been described as an environmental health epidemiologist. Can you kind of describe for us what type of research do you do as an environmental health epidemiologist?
Yeah. Well, much of my work has focused on, with the Milton Lab, has focused on measuring and quantifying viral loads and exhaled
Mm.
breath from individuals infected with influenza or SARS-CoV-2, and understanding potential drivers of high viral aerosol shedding loads. Um, so this is sort of where we apply some sort of models to understand sort of population shedding dynamics and factors that are associated with high or low shedding. That's sort of one approach. We sort of another way that we sort of apply epidemiology is in population surveillance or monitoring of cohorts. So, for example, we did this in the dormitories at the University of Maryland, where um, we enrolled people in our study and checked in on their symptoms through an app periodically, well, daily. And when people reported some sort of illness, we would try to get them into the lab to give some samples and track infection that way. We were at the same time measuring ventilation in these different dormitories. And we sort of had a nice little natural experiment because one of the dormitories was recently renovated and had a much higher ventilation, clean air delivery rate than another dormitory. Those were the two dormitories that we were studying. And we did see a difference in infection detection rate in these two dormitories, with the lower ventilated dorm having I want to say almost 3 times more infection detected, infection rate detected
But
over the course of the study.
and that makes sense actually. If, if you think about it, right? It's certainly like a lower ventilated space, more opportunity for reentrainment and higher exposure rates. I mean, it seems logical.
Yeah, some of the modeling that I did in these dormitories showed that the ventilation rate can really make a difference for someone that's shedding, for example, the median amount of airborne influenza that we observed in our campus community. Um, but we also did see that when there is a super shedder in the room,
Mm.
someone shedding at perhaps the 90th percentile or higher in the community, uh, it was much harder to sort of reduce the risk in those situations based on the sort of standard well mixed air assumption and risk model. Um, for example, between two roommates that spend a night together sleeping, and one of them shed a super shedder. Um, so this is where like potentially germicidal UV may be able to interrupt some of that transmission, but certainly perhaps not. Even if we were to dramatically improve ventilation or add a whole bunch of filtration, it might not.
But I mean, you do raise an interesting point there because obviously, even the clean air delivery rate obviously is factoring in that it's in the occupant breathing zone, right? That you're actually delivering clean air to the occupant, where they're actually breathing it, as opposed to just overall air changes in a space may not be that effective, right? If it's stratified, or I mean, there's a lot of assumptions there that you get uh, laminar flow in the space, or you get it's just not the case, right? In a lot of environments, and of course in a sleeping environment, that's totally different, because you probably have bunk beds in a dormitory, so now there's like you're stratifying via temperature, and it just seems like to actually come up with systems that really effectively work there would be challenging, right?
Yeah, for sure. I know if I were in a dormitory, I might want some germicidal UV light to sort of assure that we have some clean air like in the breathing zone.
I think I'd want a bubble around my bunk
Yeah.
bed, to be honest. I mean, if I have to be in a room with somebody.
Yeah, it is interesting. Like, should we be wearing baseball caps that have a little germicidal UV that's like cleaning the air that we're breathing, or should we be wearing around a little portable? I know there's been some discussion of wearing a little thing around the neck.
I got to tell you, through the whole pandemic, the early times, I had this small HEPA device, a USB charged with you hook the hose up to an N95 mask, so you kind of looked like Darth Vader walking around with that. And I was, if I had to get on a plane, I definitely was wearing that.
Yeah.
Why wouldn't you?
Yeah, well, the well-fitting respirators can really make a difference. I know I feel much safer when I wear mine out in public. Uh,
So,
public indoors.
bringing that, you had mentioned the dormitory studies, but you also did a number of studies on K through 12 schools as well, which that has gotten a lot of publicity, nationwide in terms of what type of protections we should be giving to the to those age kids. Can you describe some of the research that you did in the K to 12 schools?
Yeah, so we've done two things here with Lawrence Berkeley National Lab regarding the schools. One was a little sort of risk assessment where we applied known parameters of airborne SARS-CoV-2 uh, risk, airborne transmission risk to a typical K-12, or I think we focused on high school, and tried to estimate some benefit, some potential benefit by increasing ventilation, increasing filtration, and or increasing or implementing some germicidal UV light, some upper room UV, and sort of modeled what these approaches, how these approaches might influence the R naught, the reproductive ratio, and sort of how much might be needed to get below 1 to sort of quell sort of a pandemic. The interesting thing in these congregate settings is the potential for super spreading, which has been observed in quite a few high density settings. So I guess there's still some question about to what extent these air cleaning strategies can probably would reduce some risk, but in terms of like mitigating transmission up close at close range between people. But certainly it seems like there's good potential to reduce super spreading events or transmission happening across a room space among people that weren't really having a close interpersonal interaction. And so that seems where a lot of this benefit, where there's more certainty that there's a lot of benefit from implementing these indoor air cleaning policies. And so this also sort of lends well to that it could be helpful to keep some spacing to sort of reduce the higher risk, because we know there's this higher risk at close interpersonal sort of contact where you're breathing another person's sort of aerosol cloud coming out. And so that's one of the things that we did in the schools. Another thing that we did was a survey of K-12 schools across the country to understand what they were doing in terms of air cleaning during the pandemic. We found that we may have had a biased sample because we reached out to schools within our network that were potentially tuned in to some of the air cleaning seminars or workshops that were conducted potentially through the EPA's Healthy Schools program. and or indoor air in schools program. I'm getting the exact name mixed up, but uh, and elsewhere. So we did see that among our sample, these schools were conducting a fair amount of air cleaning. There was a lot of interest in improving ventilation through HVAC systems or adding filters. What we also noticed is that only 4% of the school districts use germicidal UV in any way. And many expressed concerns in focus group interviews of safety related to germicidal UV. And there was a unfortunate case that was cited in, I think, Cobb County, Georgia, where whole room GUV 254 nanometer was shined down into classrooms and meant to be turned off when individuals were in the room, but there was some problem with that. Anyway, so there are these cases where germicidal UV is not done properly, and unfortunately, that seems to have sort of spread some bad PR across the nation to other districts that might be interested in trying it. But yeah.
So that's unfortunate, as you mentioned. Well, other air cleaning devices have been used in schools at that may or may not necessarily be emitting ozone in some cases. You know, I mean, I've seen in some reports that there's hundreds of thousands of these devices that have been spread throughout schools in the United States alone. I mean, what thoughts do you have on those types of air cleaning devices?
Yeah, so you're probably talking about the sort of range of
Ionizing, yeah.
ionizing devices. Yeah, I don't know. They, it seems like you're probably correct that some of them may be producing some ozone, although it seems like there are ionizers that may not be
Mhm,
producing ozone or have sort of
Mhm.
solved the ozone problem. Um, I think there was a recent study that was sort of doing some testing on some of these devices. I mean, um, I guess the other thing is sort of what else is being sort of emitted sort of emitted into the air, free, any sort of like
as part of the process, right? I
yeah,
mean,
free
because
radicals or whatever.
exactly, yeah.
I don't know. It seems
There's chemistry occurring if you're, oxidizing things, I mean,
right.
obviously.
So, yeah, I mean, it does seem like there has been in sort of the field some concerns about safety for these devices, but also for in terms of how effective they might be in the
Sure.
first place.
Yeah, the efficacy, I mean, questionable sometimes.
It
Yeah,
is. I mean, that's where I think you're talking about a recent study that they did where I think they went beyond the chamber type of study to a much more larger facility that they were doing the testing in, but it didn't necessarily show that this was all that effective in terms of air cleaning, particularly of bioaerosols.
So,
right. And the other interesting thing is that we have a great suite of
Hmm.
air cleaning tools with filtration and germicidal UV and ventilation that we know that we have more good evidence for that we could be promoting more. So, um,
I
yeah,
agree. I mean, it seems like we end up uh, looking for the magic box instead of basically taking the box and like the Corsi box that he's taken to different parts of the country, which is just strictly a ventilation type of device rather
mhm.
than basically trying to kill the virus or kill anything else by having it emit certain types of ionizers. So we'll see how that all plays out. So I don't think that's the focus of what you've been doing, though, at Lawrence Berkeley at this point.
We do have
No,
so
it is not.
we do have some questions to the audience. I'm going to bring the first one up here. This was I'm looking at installing upper level germicidal UV light fixtures in the common areas of a low income seniors apartment building, ceilings of 12 feet. And the rest of the question is wondering if it's better to go UVA, safer, or UVC, more effective. Can you offer any advice on that?
Yeah, so all the time when we're talking about germicidal well, we're generally talking about UVC. And for upper room fixtures, you can use it's the standard 254 nanometer wavelength UVC. At a 12-foot ceiling, that's really great. You can use these open fixtures that sort of can get away with less louvers, so more of the light gets into the space, and you can kind of point them upwards above people's heads, and get more air cleaning in that upper room zone. And if you have a ceiling fan, that can help mix the cleaned air from the upper room back down into the breathing zone, and sort of back around. So yeah, that seems like a great way to use germicidal UV, a great setting for it. Yeah, I hope you explore it more.
So we have one other question I'll bring up. So you're assuming that controls that reduce overall SARS CoV-2 exposure actually reduce transmission. I can't find any epidemiological studies documenting this. And please provide citations of your work on this, citations of other work not based on modeling, but actual COVID cases. And there's some other follow-up to that, which we can get to later. So flash these up again.
Controls reduce transmission. Yeah,
It's a long
let's
one.
see. I'm trying to think off the top of my head of studies. I mean, there are a range of studies now that have sort of related, have managed to link, I think, ventilation rate. I mean, even this study out from Italy, in schools, with schools that are better ventilated, associated with lower transmission of SARS-CoV, or lower incidence in schools. I think there's sort of more of these studies are coming. I think this also points to sort of the challenge with doing these studies. It would be great to have a little bit more. I mean, when we did these sorts of epidemiologic studies at the University of Maryland focused on influenza and other respiratory viruses, we worked really hard to get a strong cohort of students that were enrolled in our study that we could follow over time. In the community, we don't really have comprehensive infection monitoring programs. And so oftentimes it's really challenging to link up different, air cleaning use of air cleaning strategies, ventilation, germicidal UV with actual reductions in case counts. But there's a lot of good evidence mechanistically that these air cleaning strategies do work, and can actually are either removing the virus from the air or inactivating it. And so we can, based on everything that we know about the infectious dose generation rate, and the relationship between that and infection, a given exposure, there's sort of strong evidence that the air cleaning strategies work. What else? I would say that Oh, also, it's also sort of known that for influenza, and there is some evidence for SARS too, that the dose makes the poison. So the higher the exposure, the more likely to occur, but also more severe disease. So this has been shown for, well, and also especially airborne inhalation dose for influenza. And so reducing exposure in any way can give some benefit, even if infection is not hindered in certain cases. It's possible to potentially reduce the impact
So
of that infection.
the severity on the individual that contracts
Mhm.
it. Okay.
So I've noted in your CV, you talked about that you conduct quantitative aerobiological modeling to estimate airborne transmission risk for SARS-CoV-2 and to support interventions in public spaces, schools, correctional facilities, film sets, and others. Can you kind of describe to us the modeling that is completed in order to estimate an airborne transmission risk of SARS?
Yeah, so we use basic, I mean, there's a basic sort of general model for airborne viral transmission, the Wells-Riley equation
Right.
that many people are familiar with. And if you have CO2 measurements indoors, you can use the Rudnick-Milton rebreathed air sort of version of the Wells-Riley
Mhm.
equation. So the critical parameter there is the quantum emission rate, which is the infectious dose generation rate from someone who's infected and shedding virus into an indoor space. We sort of have some understanding of what this quantum emission rate is from um, studies that have quantified transmission, various outbreaks, where the exposure, how long people were together in a space, the number of people in the space, how much ventilation was happening in the space or other air cleaning. Um, so these sorts of studies, like the restaurant in Guangzhou, or the choir in Skagit Valley, or or others. There have also been numerous for influenza. Um, so these sort of help us to benchmark sort of what the quantum emission rate might be. Um, and others have done some work linking the number of genomes detected in the air with the sort of load of infectious virus to get some understanding of sort of how infectious. Um, when we say there's like 1,000 copies of viral genome in the air, how much of that is really infectious virus? So there's people working on that side of it right now. Although it's often sort of hard to culture the virus in general.
Mhm.
But these outbreak studies really have shown how infectious the virus can be, and have sort of given enough information about um, what is a reasonable estimate uh, in terms of doing some sort of risk modeling or risk assessment. Um, Often we may want to take a conservative approach and consider that someone can be very infectious in an indoor space, um, if we want to try to mitigate uh, the most amount of transmission possible.
I was wondering, you mentioned that you have done some work with the film industry and as a role as a scientist, a scientific advisor in reducing COVID-19 risk on film sets. Can you kind of give us a little bit of description of what that was about?
Yeah, this is work that I did with Sabrina McCormick, who's
Mhm.
a environmental health professor at George Washington University. She started a company, Pandemic Proof Productions. Um, as someone, she had been involved in film throughout her career. An Emmy winner for The Years of Living Dangerously,
Mhm.
focused on climate change. And so she's involved in this industry that didn't really slow down potentially that much. I'm not exactly sure what sort of the extent of the slowdown of filmmaking was in Hollywood during the pandemic, but I do know that it was deemed an essential um, business or essential service. And so much of the filmmaking was going on throughout 2020 and the early part of the pandemic and 2021. Um, so Sabrina was in there. She was trying to make the film sets safer so that there weren't big transmission events happening on sets that can really um, throw back a production. Um, so it was really wonderful to work with her. We did a little bit of modeling to sort of figure out uh, um, how to sort of work CO2 monitoring on sets, and if the CO2 levels reached a certain threshold, what then they would have people go out for a fresh air break. Um, they were also able to use heavy duty air cleaners because, as I learned in this in this industry, when when they're shooting film and it's really cold outside, but it's actually like a scene in the summer. They have these like heavy duty air blowers that can like deliver a lot of like warm air into a space. And so we took advantage of those tools to sort of add clean air into different spaces on sets, use some germicidal UV. And also there were a team of people on these sets that really helped enforce sort of pandemic controls. So it was a wonderful experience of like translating some of the basic knowledge about what we know can help mitigate exposure onto the film sets. And um, it seemed to be remarkably effective. We didn't really have um, many transmission events observed on the sets. And um, yeah,
Did
so
they offer you a small part as part of your compensation for being on the film?
yeah.
Only you would follow up with that, Don. It's
I don't
like
know, but yeah, Amsterdam, the movie Amsterdam we worked on, and yeah, you should see it. It's really
everybody
enjoyable.
was in it, and pretty
Yeah.
much.
That's the only reason why, like, some of the productions were lower budget, so it was nice to work on, like, one where I mean, product they have to have enough, budget to get sort of the pandemic-proof productions out, but yeah, so it was a good experience.
Interesting. Don,
Vision
we have another audience question. I'm going to try to
Sure.
pull it in now.
Mhm.
There always seems to be a rub between local energy codes and national standards, such as LEED, Passive House, etc., which generally want to limit the ventilation rates for energy saving reasons. So, using ERVs can help in new buildings, but what can be done in existing buildings?
Mm,
Interesting question.
yeah. Well, yeah, this is a good point about now what we're thinking about. I mean, much of the focus of um, the Lawrence Berkeley National Lab is focused on, in our particular area, is focused on decarbonizing the built environment. And since buildings are a major consumer of energy across the country, um, so yeah, but how do we do that and at the same time try to promote health and wellness and reduce airborne transmission of disease? So yeah, the ERVs are one thing. So for retrofits, I guess another sort of approach for retrofitting could be to use germicidal UV. I know many sort of institutions or schools that we've surveyed have tried to redo their entire HVAC system, and that can be a hugely disruptive and comprehensive sort of change. And maybe it helps increase the ventilation rate overall by um, an air change or a few air changes per hour. But but yeah, there's a lot that can be done by simply adding a germicidal UV fixture with a ceiling fan, or adding some filtration um, devices into the space. There's a lot of talk about heat pumps now as sort of a nice, more energy efficient way of um, dealing with thermal comfort indoors, but also sort of providing some airflow. Um, so yeah, it's a good question that I think that we're exploring more how to provide sort of optimal clean air in a energy efficient way.
I was wondering, you and your colleagues published a research paper entitled Control of Airborne Infectious Diseases in Buildings, Evidence and Research Priorities. Can you please tell us about this paper and what are the research priorities listed in it?
Yeah. Well, this is a paper where we sort of went to the literature and synthesized a lot of the wonderful work that had already been done or was actively being done during the pandemic. Um, and we sort of laid out a way to think about using buildings and air cleaning strategies that I've talked about here a lot: filtration and germicidal UV and ventilation and airflow, as a way to mitigate airborne viral transmission. So we're sort of summarizing what was known about how effective these strategies were, how they could be used. We also did a little bit of a modeling piece to understand to what extent exposure might vary at an interpersonal, interactive scale versus a room scale. So we showed that there was maybe mostly sort of less than tenfold difference in exposure across those between those two different scales for most particle sizes, getting or approaching sort of a tenfold difference. But we did also lay out some research priorities into sort of three categories. One was in well-characterized environments, these sort of classic chamber studies, and using computational fluid dynamics to support sort of understanding of within room spatiotemporal movement of infectious aerosols. These sort of well-characterized environments could also be used to better evaluate germicidal UV and air cleaners, filtration-based air cleaners. There were also research priorities in terms of practice-based, and this is what I was getting into earlier in terms of population monitoring and surveillance for infection in various settings. This would sort of help with evaluating air cleaning effectiveness more broadly in the population, evaluating and sort of doing forensics on super spreading events or big outbreaks when they did happen, to have some information on how much air cleaning was there, how many people were there, how many people were infected. And then there's also sort of some research priorities in terms of methodologies, metrics and test methods, and sort of working on this question of how do we get the most out of the control measures that we have? How can we sort of optimize them and refine them and measure them and sort of give them a stamp of approval that they do what they say they're going to do?
So we have a couple more audience comments and questions. I wanted to point out that this entire program, the recording, the video recording, and the audio podcast will be available immediately after the show at global.healthyindoors.com. You can go to the website and go to where we actually have it posted, which is, so we'll get you right to that screen here. Yeah. The show, the actual program for the show. And we're live streaming it. And it's under Indoor Environment Show on your left-hand column, and episode 13. So just to make sure you can find it. So one of the questions that the audience had for you, Jacob, is could you actually post the link to your research? And we can include that with the show notes, or if you have a chance to put it up in the chat now, we can screen it up on the show.
You can find me on Google Scholar. I think most of the stuff is there, or ResearchGate. Yeah, it's online.
And then we had one more question/comment from an audience member. Okay, here it is. Italian study referred to did not have any idea of what HVAC systems ventilations were in the schools. So your UMD studies showing HVAC controls reducing transmission were apparently limited to flu, not COVID. Well, it should be SARS-CoV-2. Have you or other researchers actually shown this for SARS?
I can't think of anything off the top of my head for SARS-2. I'm not sure. And with respect to the Italian study, yeah, you're right. Like, a lot of the existing evidence that we have is a little bit crude, because, and this speaks to sort of the research priorities that I mentioned before, that we don't necessarily have systems set up sort of across the society to be sort of comprehensively taking measurements about indoor air quality, ventilation, air cleaning, and at the same time, tracking infections in a population. So there are various school districts that are kind of doing this, and it's sort of, I would think that in the coming years, with all of the infection monitoring during the pandemic, we'll probably see more of this research coming out. There's a lot of sort of anecdotes about lots of transmission that happen in poorly ventilated spaces. It seems like there hasn't been observed many super spreading events happening in places that are highly ventilated or using a lot of germicidal UV or filtration. So we sort of have these like sort of crude categorical sort of understanding about about this in real life. And this is actually something that interests me a lot. Like, I would love to sort of present, do an intervention study where we add GUV to a school and track the infections over time, add it to a restaurant and be measuring every, infections in people that are at that restaurant over time. There's things to do, but we need funding and support to be able to do it.
Sure.
And yeah.
Well, I mean, the anecdotal is the starting point for your epidemiologic studies anyway. I mean, it has to start somewhere.
Yeah. I mean, there is also a lot of opportunity now with big federal money coming for school indoor air quality improvements, with the ESSER funding and even um, the bipartisan bill that passed in the fall, that will support sort of these sort of air cleaning strategies in schools. And we know from our surveys of schools that this money really does help and is being used to buy up air cleaners, improve filters to MERV 13 or better. So we know that this money is sort of is being used. We also
Well,
know that.
it can be helpful if they have the right guidance. So, I mean, because the other thing is there's this assumption that schools will make the smart decisions, but they're not necessarily fully informed consumers when they're going out and purchasing these technologies that, maybe within the district, they don't have that expertise.
Yeah, and that's a huge opportunity for us right now, that we need to make sure that any school district that is going to use these funds and wants to make these changes feels like they have the technical support and guidance to be able to make the best decisions, get the best benefit for their money, get the best benefit in terms of infection control and indoor air quality in their schools. Um, One of the things that's interesting is we also found some differences in um, school district characteristics, in terms of social disadvantage and with respect to um, how much implementation of air cleaning was being done in the district. So, for example, districts that had a higher percentage of free and reduced price meal eligibility um, were potentially more likely to not have implemented as many control measures, indoor air quality control measures during the pandemic. Um, Districts that had a higher percentage of non-white students um, had a similar finding. And this goes for not only the control measures, but also indoor air quality monitoring, such as CO2 monitoring or evaluation of HVAC systems and airflow.
But that's not a surprise, though, right? I mean, it's pretty well known that there's a racial inequity in public schools. I mean, this is, and I think maybe this recent pandemic, really illustrated that pretty heavily.
Exactly. Yeah. It's like nothing that we maybe didn't already suspect. I guess one of the things that was interesting is we thought that maybe larger school districts may be ones that had staffing or resources to do more air cleaning, but we also showed that that wasn't necessarily the case, that oftentimes it was a larger districts that weren't doing as much air cleaning. But that could also be because some of these larger districts were districts that were had greater social disadvantage as well.
Well, we're out of time. We do appreciate this visit. I should mention that we were originally having two researchers here. Marco Philippe King was unable to join us today. We hope to catch him on a later date. But we do appreciate, Jacob, what you being here and exploring with us some of the things that you're doing in terms of your research. And I thought it was really worthwhile. So back to you, Bob.
So yeah, so it also wanted to remind you that the this program, right, the Indoor Environment Show, is a joint production of the International Society of Indoor Air Quality and Climate (ISIAC) and the Indoor Environmental Quality Global Alliance (IEQGA). Lot of words to get out there quickly, but we've been doing the show for over a year now, and it's always a pleasure to bring experts like Jacob on to get involved and speak a bit more on some of the interesting stuff that they're doing and talking practical applications with it. So we'll be back again next month, right? I
Yep.
believe, right? And it's somewhere before the holidays. We actually don't have a date yet, or do we?
Not as yet. No.
Yeah, it's gonna be late December though, so stay tuned. And again, this episode is is available now at global.healthyindoors.com. So you can go to that website and scroll down the left side and look for indoor environments on the left tab, and you can see all 13 episodes. How exciting! So I guess without further ado, I want to thank Jacob for joining us today. Don,
Hang on a
as all.
second, Jacob. After we close the program, if you don't mind.
Oh yeah,
Go
I
ahead.
guess that's our post thing that nobody gets to see. But it's the secret club. You know, you're part of the club now, Jacob, because you've been a guest on the show. But anyway, we'll be back again. Next month for another exciting broadcast of the Indoor Environment Show. Until that time, please stay safe and healthy.